My name is Savi Glow, and for the past 5 years, I was privileged to serve as the event chair, organizer, and host of the annual LymeMIND conference. It is an honor to be welcomed back to help moderate this next panel, which is near to my heart. In 2019, Dr. Neil Spector joined LymeMIND as the keynote speaker, where he shared his exciting work in Borrelia therapeutics and diagnostics. Sadly, Dr. Spector passed away in 2020, a loss felt deeply by this community and, of course, by his family, friends, and colleagues. With me today are three of Dr. Spector's colleagues, Dr. Monica Embers, Dr. Ed Breitswert, and Dr. Tim Hasted, who will update us on where this critical work has left off. I'll let them give a brief introduction before we dive in. Dr. Embers?
Hi, I'm Monica Embers, and I'm an associate professor at Tulane University. I've done a lot of research focused on animal models of Lyme disease, and now we're switching gears and including Bartonella in our research studies.
I'm Ed Breitswert. I'm the Melanie S. Steele Professor of Medicine and Infectious Disease at North Carolina State University College of Veterinary Medicine. I'm a veterinary internist by training, and my research lab has focused on the genus Bartonella for nearly 25 years.
Hi, I'm Tim Hasted, Professor of Pharmacology at Duke University. My lab focuses on the development and discovery of novel small molecule inhibitors of various enzymes, chiefly in cancer, and now more recently in Borrelia and other infectious diseases.
Thank you. So Dr. Hasted, Dr. Spector discussed your work on Lyme Borrelia therapeutics and diagnostics in 2019. Can you provide us with an update on those projects?
Yeah, so both Neil and I had a background, as I've mentioned, in cancer and development of molecularly targeted therapeutics, and for most of our careers. And and I know Neil for at least 20 years prior to even starting working on Lyme. And one day he came to me and asked me about whether the methods that we had used to develop 2 or 3 drugs that are now in clinical trials for cancer, those same methods could be applied to diseases like Lyme disease, and in particular Borrelia. And I didn't see why not. So he brought me into this project, and it's been a marvelous experience, and opened up some new avenues and doors for us, and new ways of thinking for development of antimicrobials in general. And what I've got on the slide here is sort of the culmination or punchline of the work, if you like, that was funded originally by the Cohen Foundation to develop a set of targets we had hit on. And I wanted to show, what one of the molecules that we discovered and developed does to Borrelia. It's the only slide I'm going to show, and it's actually a movie of spirochetes that have been treated with our drug, and what it does to them, which is extraordinary, that results in their permanent death. And we think, based on this data or this finding, that our drug can irreparably damage the organism such that it could never recover, and we could imagine it as being developed into a therapy, a novel therapy. And the drug targets a protein called HTPG, which is involved normally in protecting the organism against cellular stresses, but is not normally thought of as a conventional drug target. But I'd like to show this movie with you now, what happens when we give the organism in culture this drug. And this is a electron microscopes, electron transmission and electron microscopy, a 3D construction of a single spirochete that had been treated with the drug, and then the structural organization of the organism was examined at various planes, and a movie is constructed. And what we're seeing is that yellow rod that you saw in the middle is collapsed DNA. And it looks like that drug, when it becomes activated, causes normal linear chromosome of Borrelia to collapse into a single strand. And when this forms, the organism subsequently falls apart and dies. So it's a novel mechanism of death, and quite a dramatic effect that has not been seen in this organism. So that sort of summarizes, our hope for this project, and how we've come across something novel, or a novel mechanism of spirochete death. And we think this approach that we're using can not only be developed to develop a novel therapeutic, but also as a diagnostic tool using the same molecule.
So a quick follow-up, assuming the research goes well, when do you expect to conduct clinical trials in humans for these Lyme therapeutics?
Yeah, well, I think that the PET version that we're developing, this is will be developed as a diagnostic. We're hoping by the end of next year. I mean, the project has been picked up by Bay Area to specifically develop that aspect of the program. And I see that as one of the more immediate paths to a clinical trial, simply because, as we all know, that it's critical that we're able to accurately diagnose infection in a chronic setting, in chronic disease. So I think that's our best bet. And we've got a few PET studies planned over the coming year. And if the molecule behaves and we're able to image an infection in an animal model, I think we're on the clinical path then.
That's very exciting.
Yeah.
Dr. Embers, Duke and NC State and Tulane are continuing their work on a Bartonella consortium. What are the overall goals of the Bartonella consortium? And if successful, what does the group hope to achieve?
So I wouldn't be here without Neil Spector. I remember many years ago, he approached me about my Lyme disease models, and he said, well, let's come up with a Bartonella model as well. And I said, sure, no problem. And that's turned out to be a little bit tricky. But one of the things that really, other than the fact that Bartonella and Borrelia are both zoonotic diseases that are transmitted by vectors, there are a lot of commonalities between these two bacterial species that have really drawn me to it. And I think that we can approach the treatment and diagnosis with similar methodology from what we learned with Borrelia. So both of these pathogens can engage in antigenic variation, and by doing so, they can engage in immune evasion and actively suppress the immune response. We also know that they both result in chronic disease, and they're also very difficult to treat. Like Lyme disease, Bartonellosis is also a systemic infection, and sometimes it's difficult to detect, which makes diagnosis very challenging. Next slide, please. So what the consortium hopes to accomplish is to develop a novel therapeutic for Bartonellosis. And it really starts with the chemistry, and that's what Dr. Hasted is doing at Duke University. And the goal is to identify candidates of small molecules that inhibit critical processes required by the bacteria to live. And then those molecules, once we show that they can inhibit the growth of Bartonella, then the next step would be to test those in cell-based assays, because we know that Bartonella lives not only intracellularly, but extracellularly. So we need to test the candidate therapeutic in both model systems. And then the subsequent step, once we show efficacy in the cell-based model systems, is to test the therapeutic in preclinical animal models of Bartonellosis. And we have developed, to some extent, some models that will do the job. So we can test these in animal models. And then once that's complete, then we can proceed with the IND enabling studies, the drug synthesis, toxicity, and apply for FDA approval.
Absolutely. I too was fortunate to be brought into this group by Neil Spector, and such a tremendous loss to all of us in so many ways. And before 1990, it's quite remarkable that we did not know that any Bartonella species infected any animal on the North American continent. In the 1990s, as a result of the AIDS epidemic, Bartonella henselae and Bartonella quintana were identified in HIV-infected individuals, and Bartonella bacilliformis was already a well-known disease in the Peruvian Andes, where it's transmitted by a sandfly. Next slide. In the subsequent years, our laboratory and others have continued to identify new Bartonella species and subspecies. And what we've come to appreciate, which is those that are listed in the white color, is that some of these are capable of making the jump literally via a vector or via animal contact into a human or into another animal. And so all those in white have been associated in case reports or case series with pathology in animals or humans, most often from our laboratory, dogs or humans. Those in yellow to date have only been found in their reservoir host. Next slide, please. The other, as Dr. Embers pointed out, the commonalities between borreliosis and Bartonelloses are quite similar and important. And what I'm trying to emphasize by this cartoon is Bartonella is somewhat unique in the context of vector-borne organisms in the number of cells that it can invade. And if you can invade a lot of cells, you can actually cause disease in a lot of organ systems. We all know that disease is kind of an imbalance between the host trying to protect the individual and the organism that the host is not able to completely eliminate. And as a result, we just see a very wide spectrum involving numerous organ systems in association with both borreliosis and Bartonellosis. And in this slide, what I want to emphasize, I guess on the next three slides, is the gentleman in the middle and focus in specifically on the neurologic manifestations, which are a current focus in our research lab and a current focus of the consortium, and use some case examples to illustrate why Bartonella is important to understand and study. Next slide. So these three cases were all ones where the parents actually contacted our laboratory and requested that the individual be entered into our IRB study. The first is an 18-year-old woman with a 4-year history of progressive peripheral visual loss, sensory neuropathy, and hallucinations. This was actually somebody living in the Raleigh area. I got to meet the young lady. She literally could not see from the right side to the left side, but she continued to drive a car despite the fact she wasn't supposed to. You can see that she had other symptoms as would have been depicted in those other skeletal muscular organs that are also being affected by this organism moving through the circulation. And in this instance, you know, would most physicians actually, with just this history, test for Bartonellosis? And I think the answer to that question is no. But what we were able to document by culture, PCR, and sequencing was infection with Bartonella cholerae, for which the primary reservoir is the cat. Next slide. The second patient is a 14-year-old girl with a 5-year history of intermittent fever, ocular pain, and balance problems. You can see a spectrum of other problems that we could attribute to the nervous system, including hallucinations, memory loss, insomnia. And I think, again, similar to patient number one, a lot of manifestations involving the joints, the muscles. And one thing that is reasonably clear clinically is that all these chronic infections, if they can involve the nervous system, can result in autonomic dysfunction. So we see a variety of tachycardia, bradycardia, vomiting or diarrhea. And this really makes the diagnosis, or even having these diseases on the differential diagnosis for a clinician, very difficult. And in this instance, this young lady, who was from a rather affluent family, was infected with Bartonella quintana, which you're only supposed to be infected with by the human body louse. And obviously she had not seen human body lice. And she was also infected with a rodent Bartonella species, Bartonella vinsonii, subspecies for vinsonii, that we had never seen in the lab before. So, and again, both of these were amplified and sequenced from her blood. Next slide, please. So the final case is a 14-year-old boy with an 18-month history of progressive neuropsychiatric syndromes. The diagnosis initially was fairly typical. The boy was depressed and perhaps under too much pressure from school. He then was diagnosed with early onset psychoses and finally was institutionalized at a specialty hospital for a couple months, where he was diagnosed with schizophrenia. During that time, literally a year and a half, he was evaluated by 4 different psychiatrists, and he actually had complete resolution of his neuropsychiatric symptoms with Bartonella-directed therapy. And again, this is what Dr. Embers, Dr. Hasted, and I are all about, is finding a drug that can result in resolution of symptoms, regardless of what organ system we're talking about. But certainly, if Bartonella contributes to neuropsychiatric disease, which these cases and others that we've published would support, then we're going to have a very novel approach to managing some of these diseases that's actually unprecedented in current medical practice. So this young boy was infected with Bartonella henselae, and you'll see that the reference for all 3 of these published studies are focused at the top.
So as a quick follow-up to that, Dr. Breitschwert, can you tell us who is at most risk for Bartonella infection?
Yes. What's changed in our lab over at least the last 15 years, as more and more Bartonella species have been identified, early on, we thought that you had to be a veterinary worker or a forestry worker, someone that had a lot of contact with ticks, with fleas, with biting flies, that to acquire an infection with this organism. As we started to understand the expansion of the large number of reservoir hosts out there, some of whom are family pets like dogs and cats that sleep in our beds, then the story started to change. And we currently wonder if anyone can make it through life without being exposed to these bacteria. And obviously, if that's true, then most people eliminate the infection probably shortly after it's injected through the skin by a vector or a scratch. It's those people that don't eliminate the infection and develop a chronic illness, and we can still find the bacteria present, which Dr. Hasted alluded to, the need for improved diagnostics to go along with novel therapeutics that's so important.
Dr. Embers, as a side note, you recently published a very influential study about the presence of Lyme bacteria in the brain tissue of a dementia patient who received standard IDSA antibiotic treatment for Lyme disease. Can you give the audience a quick summary of the study and what it means for patients and what it means for the medical community?
Certainly, this was a very interesting case. The woman had presented with a bullseye rash. So she had the case definition of Lyme disease up front. She was treated with the standard course of doxycycline and actually initially recovered. But over a period of the next 2 years, she started to decline. And there's no evidence that she was bitten by another tick or had another subsequent infection because her physician did multiple tests. And her physician treated her more extensively with antibiotics, including intravenous antibiotic treatment regimens. And she improved to about 60%. And then over time, she started to decline again and developed what would be considered Lewy body dementia. So dementia, including motor neuron issues, and eventually passed away. And Columbia sent those tissues to our lab, and we, in collaboration with Dr. Brian Fallon, we interrogated the tissues, and we were able to find evidence of Borrelia burgdorferi in her spinal cord by immunofluorescent staining and by molecular detection in her brain. Mm-hmm. What does it mean? What it means to me is that what we have suspected for a long time, that the standard courses of antibiotics are not a one-size-fits-all, and that we do need to consider much better treatment options for Lyme disease, and also I think definitely for Bartonella.
Yeah, absolutely. So for the group, are there any additional thoughts or anything you think the audience should know about your work in Lyme and Bartonella research in general?
I think we all want to thank the Stephen and Alexandra Cohen Foundation for supporting this initiative. It's very important, and it's it's underfunded by larger funding opportunities, and we really appreciate that they're recognizing the problem of Bartonellosis.
Absolutely.
Yes, I think all of us really want to thank the Cohen Foundation for this support, and this is the largest grant that's ever been awarded in the United States in support of Bartonella research. So as someone that's been in that area for a number of years, I've been praying for a tipping point, and this clearly is the tipping point. And I hope that this consortium represents the A team that brings a drug forward, both for Borrelia and Bartonella, that is effective.
Well, thank you. Thank you three for joining us and for being part of this panel discussion. I believe that we'll return to the live broadcast, and there'll be questions from the audience around the world. So thank you.